while preparing us for your arrival shortly. We will constantly remind you to follow all safety precautions so that you remain safe and do not have to go away again. You, dear students, are the soul of the campuses, and we are lifeless without you. Please come back as soon as is possible and put the life back in our campuses. The campuses are empty and life has come to a standstill. The roads are empty and miss the buzz of activities around them. The buildings are empty and the classrooms miss the occupants. Your teachers miss the personal interaction as it cannot compare with online teaching sessions. The canteens miss the shorgul, halla gulla, endless conversations and the camaraderie that was there. The playgrounds need running feet, not grass growing on them. The pandemic has taken you all away from us and we really miss you. The management has followed all the guidelines while preparing us for your arrival shortly. We will constantly remind you to follow all personal interaction as it cannot compare with online teaching sessions. The canteens miss the shorgul, halla gulla, endless conversations and the camaraderie that was there. The playgrounds need running feet, not grass growing on them. The pandemic has taken you all away from us and we really miss you. The management has followed all the guidelines while preparing us for your arrival shortly. We will constantly remind you to follow all safety precautions so that you remain safe and do not have to go away again. You, dear students, are the soul of the campuses and we are lifeless without you. Please come back as soon as is possible and put the life back in our campuses.
Then MD thesis and 2 PhD thesis under the guidance.
The campus is the personal interaction as it cannot compare with online teaching sessions. The canteens miss the shorgul, halla gulla, endless conversations and the camaraderie that was there. The playgrounds need running feet, not grass growing on them. The pandemic has taken you all away from us and we really miss you. The management has followed all the guidelines while preparing us for your arrival shortly. We will constantly remind you to follow all safety precautions
thank you, Dr.
so that you remain
for
safe
your very
and do not
vast interaction.
have to go away
And
again.
thank you. And
You, dear students, are the soul of the campuses
all the
and we
people here
are
for
lifeless without you.
the session.
Please come back as soon.
And I thank the organizers for providing me this opportunity to present this lecture. And I think I'll start the lecture now.
Yes, ma'am. All of you, please mute yourself.
Yeah.
Yeah. And you can give them any queries that you have on the chat board. Now you can start.
Yeah.
मैम आपका माउस मंगला करी मैम आपका माइक म्यूट है
Yeah, I'm just turning it on.
Yeah. Okay. शर्मा सर प्लीज आपका मैग्नेट कीजिए.
Yeah, I think you're able to see the screen. Hello?
Yes, ma'am.
Uh, Today we'll be discussing about the role of Rasayanas for health promotion and disease prevention. And we have the famous quotation, Jiveda Sharadaha Shatam, Pashyema Sharadaha Shatam, wherein a very long and healthy life has been desired and prayed for during the Veda Kalas. And again, always, if we see the ancient seers, they had a very long and healthy life. Along with that, they had excellence of their memory, intelligence, along with the physical strength because of the rasayanas, whether it is in the form of the ahara, vihara, or even the rasayana dravyas. The detailed description has been mentioned in all the Brihadrais, and again, the Rasayana Chikitsa has been given most importance because the entire branch has been devoted for this rejuvenation therapy. And again, as mentioned previously, whether it is diet, lifestyle, or medicine, the Rasayanas help in rejuvenation. If we think about the different benefits that have been mentioned in the classics that can be categorized into the longevity, best cognitive functions, health promotion, or bringing about youthfulness, enhancement of the body strength, or enhancement of the strength of the sense and motor organs, enhancement of the luster, complexion, etc., which has been quoted with a famous quotation, Dirghamayu Smritir Meda, Arogyam Tarunam Vayaha, Dehendriya uh, Swaraudaryam, Vaksiddhi Pranatim Kranti, Labate na Rasayana, Labhopayogi Shasthanena Rasayana. Like that, famous quotation has been mentioned in Charaka Chikitsa Sthana, giving emphasis on different aspects to have a long as well as healthy life with the best of the cognitive functions along with the sensory and motor functions of an individual along with a healthy skin. Like even it gives emphasis on the external appearance even in the context of the health. Acharya Kashyapa also mentions about the lustrous skin and the healthy complexion, etc., among the features of the health itself, especially if we think about the physical context. And also, strong indriyas as well as vak siddhi or the good vocabulary as well as resonant voice. All these things are the contributions of the rasayanas. Then coming on for as the previous discussed aspect, that is diet, lifestyle and medicine, that is ahara, vihara and aushadha rasayanas. Again, emphasizing upon the important aspects only, like so many things have been mentioned due to the constraints of time. I'm emphasizing only the most important aspects, wherein the milk and ghee have been given most importance. They are considered among Nitya Sevaniya Ahara Dravyas, where it has been mentioned Ajatanam Vikaranam Anutpatti Karau Chayat. So, in that context, for the disease prevention as well as health promotion, these are very important. And again, emphasis upon the balanced diet, incorporating all the food groups of the present day context, whether it is the cereals, pulses, or non-vegetarian items, along with the fruits and vegetables, minerals, all the components have been included under the Nitya Sevaniya Ahara Dravyas. They rejuvenate the body. Along with that, the various spices are also quite helpful in enhancing the absorption of these dravyas, along with that, the proper digestion and assimilation. Further, the vihara, wherein the regimen itself acts as rasayana. It has been mentioned again in Charaka Samhita under the context of Achara Rasayana, wherein Achara itself will be acting as Rasayana, can be termed as regimonial rejuvenation, wherein the various contexts of physical, mental, uh, well-being of an individual through the various physical and mental faculties have been mentioned. For example, Satyavadinam Akrodam Nivrittam Madhyamaitana, wherein the mental aspects of an individual and his behavioral aspects of an individual have been mentioned, that are ideal for promoting the health or getting the rejuvenation effects. And along with that, even certain ahara dravyas wherein the importance has been given more for the satvika ahara, incorporating the again Ksheeragrata intake. Along with that, many of the medicines have also been included. And Sadvrita is another context wherein which incorporates the individual component along with the social component of the individual, where the person will be exhibiting good behavior towards the others, whether it is his seniors, elderly people, or gurujana, or the friends, or towards the uh, here even the behavior with the Raja has been mentioned in the context, but in the present day context, our things can be taken for the government or semi-government aspects, or wherever we are working in that particular atmosphere, how our codes of conducts are there. Depending on that, our mental health is also going to depend. Along with that, there are certain other aspects wherein in the dinacharya context also, the vyayama has been mentioned, wherein it has been mentioned the best enhancer of the sthairya and bala. So that can be taken as again rejuvenator. Along with that, yoga as an component, inbuilt component in the Ayurveda, and Abhyanga, all these aspects can be taken. Further, the medicines, if we think about, the four important major rasayanas have been mentioned: Manduka, Parni, Kuduchi, Esti, Madhu, and Shankapushpi. Along with that, there are other rasayanas like Bala, Ashwagandha, Shilajatu, Haritaki, and so many, a number of rasayana medicines have been mentioned. Again, they can be acting in different ways. And these help in all together, ahara, vihara, and the aushadha together help in bringing about the health, wherein the Acharya Sushruta has given emphasis on all the domains, that is physical, mental, and the spiritual domains together through the by bringing about the balance between doshas and dhatus, uh, excellence state of Agni, or proper evacuation of the excretory products, whether the metabolic one or the food related one, and the pleasant soul, senses, and mind together, they will be helping in establishment of the health. Or again, in this Rasayana context, it will be helping in the promotion of the health. How exactly these rasayanas are going to act? If we think about, then one thing is through the rasas. Like certain rasayanas, they act through the rasa, wherein madhura rasa pradhana dravyas, they help in bringing about the nourishment or brahmana effect in the body. They directly nourish the dhatus, or else the guna. Again, that also guru snigdha guna, they will be helping. And the other way around, if it is the prabhava, certain, like we have the similar properties, even then the rasayana effect may not be there. So there the prabhava comes into the picture. So by the prabhava, all these three together, like it may be individually or it may be having a synergistic action together, wherein rasa, guna and prabhava three together are acting in rejuvenating the body tissues, and this will be helpful in two ways. One is curing the diseases if the person is diseased, or is in postponing the aging. Like aging is one such problem which is not having any remedy, but postponing it or being the healthy aging also is one of the most essential factor. So this rasayanas help in the healthy aging of an individual with less number of ailments. Then again, if we think about the rasa, like rasayana, that is the state of excellence of rasa is brought about by these ahara, vihara, as well as aushadha dravyas. So, again, if you think about the different aharas which are having the rasayana properties, are having different properties. Some are having the brahmana property, some are having the lekhana property, some are having the agni property. Like that, different kinds of the properties are manifested in these rasayana dravyas, but still we are getting the effect of dhatu vidhi. How exactly this occurs? That is, there are different ways of nourishing a body. One thing is the clearing the obstruction in the channels. There the lekhana rasayana dravyas, they act upon. For example, the rasayana dravyas like gugulu, vidanga, etc., they are considered among the rasayana dravyas. They act by the lekhana action. Wherever, like in Ayurveda, we have the concept yatra sangaha kha vaigunyah vyadis tatra bhujayate. So wherever there is Vaigunya, there the disease gets manifested. And again, if we think about the absorption of a particular ahara dravya, there also the obstruction will lead to the impairment of the absorption of whatever nutrient present in the food or even in the medicine. So that is going to be taken care of by these particular drugs. And even among the dietary items, rasoma is considered as one among the lekhana rasayanas. It is rasayana, at the same time it is doing the lekhana action. And similarly, enhancing the agni, so that bringing about the optimum digestion, absorption, as well as proper metabolism. For example, the dravyas like maricha or chitraka or even bhallataka, all these things come under the dravyas wherein they are having the Agni property and sometimes even the Lekhana property. They are very good rasayanas. For example, in the case of carcinoma and all, they act as not only rasayana but they are curative. Especially the Bhalataka rasayana that has been mentioned, and many researches have already been conducted, I think in January. So like that, so different mode of action is there, and similarly there are directly brahmana effect rasayanas. They directly nourish the dhatus, when the rasayanas, they are helpful only when the person's agni and the channels agni is at good level and the channels are not blocked. If we then administer these rasayanas, then they will act upon very well. Otherwise, if there is some problem with the agni and the person is having some obstruction in the channels, then these rasayanas, especially the directly nourishing rasayanas, may not act that well because there is obstruction. Whatever the drug action is not able to take place properly. So many drugs have been mentioned in Balya, Brahmana, Jivaniya, Ganadravyas, wherein Ashwagandha, Shatavari, Ashtimrutu, like n number of rasayanas are mentioned. Again, these have to be administered according to the various 10 factors as mentioned in Ayurveda. That is Dushyam Desham Balam Kalam, Analam Prakritim Vayaha, Sattvam Satmam Tatavaram, Avasthashta Pratavina. So all these factors have to be taken into consideration before the administration of the Rasayana Dravyas, whether it is in the form of Ahara or whether it is in the form of Aushadha. Then again, further some more examples, very rejuvenation by the clearing the channels and promotion of the tissue enhancement, where is Gugulu, Vidanga, Rasona, and promotion of tissues nourishment enhancing Agni. The that is ginger, pepper, long pepper, fenugreek, and so many other things. And promotion of the tissue nourishment. Again, few more examples like Kapi Kachu, Pupilu. Again, these have to be advocated according to the condition of the person and also the Roga Bala and Rogi Bala. All these have to be taken into consideration before the administration. And again, among the major rasayanas, four Shrestha major rasayana as per Charaka, again helping reducing the stress as well as enhancing the immunities, and along with that, they also help in the improvement of the cognitive functions of an individual. And few studies also I have conducted on the major rasayanas along with the yogic practices. One was on short-term memory of the school-going children. That was for again for four major rasayanas. One group was administered with a major rasayanas as mentioned previously, and the other group was administered with the yogic practices. And similarly, we had conducted the study on the juvenile delinquents that are present in the government observation home, and special reference to their adjustment and aggression scale. So they were measured and then they were administered with again four major rasayanas as per Charaka, and then one group, and in another group they were given the yogic practices. A study was conducted, and very recently we have also conducted a study on Ajasrika Rasayana with special reference to milk and ghee and its effect on Sharira Bala. This was a survey study wherein the survey was done on two groups. Like one group included the individual, especially the elderly people. The subjects included the patients above 60 years, and again they were administered with the Bala assessment scale, as well as their Bala was measured through the pressure as well as sit to stand test. And then in one group the people were taking milk and ghee regularly, and in another group the people were not taking milk and ghee regularly. So like that, two groups was divided and case control study, wherein we inquired the history about previous intake of milk and ghee. And again, in the group who were taking regularly milk and ghee, they should have at least taken it for 5 years. Like that was the mandatory for inclusion of in the study group. And such people, Bala was assessed through the Sharira Bala assessment questionnaire, and then along with that, the fatigue assessment scale was also done. Along with that, their morbidity pattern was also observed, and it was found that the people in the study group were having better health compared to the study in the control group, that is those who were not taking milk and ghee regularly in the diet, the elderly subjects. Next, as we speak about the nourishment, then how exactly the nourishment takes place. The brief overview, as Agni is considered as one among the most important factor for the health as well as for the longevity of a person, then the factor, this is also responsible for the absorption as well as the metabolism. So if this is proper, along with that, if the channels are not blocked, or if the slot is in a proper condition, then whatever the nourishment is there, whether it is through ahara or it is through the medicine, that is going to reach the dhatus, and this will enhance the strength of an individual, and along with that, the whatever metabolic waste are being generated, that have to be expelled properly. So this is a total process of nourishment in Ayurveda. As mentioned previously, the Ajasrika Rasayana, or this is again the term that has been mentioned in Sushruta Samhita, the no jasarasanta chetara vite. That is means which is continuous and without any bleach or break. The term Ajasrika means that rasayana which can be consumed on a daily or regular basis, or in other way around we can think about the diet items. So as previously mentioned, Kshira Ghritabhyaso Rasayanana. So cow's milk and ghee are considered as best rejuvenators that have to be taken regularly in the diet. Along with that, as I was previously mentioning, various spices like cinnamon, garlic, fenugreek, onion, turmeric, cumin, and clove, they are helpful in many of the prevention of the non-communicable diseases. Along with that, they are also having the antioxidant properties. Thus, they will be helpful in preventing the diseases. And again, these ahara upayogi dravyas, they are classified, these spices are classified under the ahara upayogi dravyas. They not only enhance the taste, but they help in the enhancement of the agni, because the excellent state of agni helps in proper nourishment. So thus it will be helpful in proper absorption of the food items, whatever the nutrients that are present in the food items. If we speak about the spices like ginger, garlic, they are also having the preventive action against many of the metabolic diseases that are swamping the world today. And again, if we think about the immunity, they are also enhancing the immunity, and they are also helpful in preventing the infections because they are anti-inflammatory. Example, the turmeric and ginger, pepper, cardamom, clove, all these things are anti-inflammatory also. So they are helpful even in the present day COVID time. These things have been advocated as preventive things which can be used in the form of kashaya for the prevention of the diseases, and many studies are also under progress. Hopefully, we'll be getting the results in forthcoming time, very positive results, because these are really not the medicines. They are quite economical. At the same time, they are commonly used by all the people. So, if they are found effective, that is, we have already known through ages, but on the parameters of the modern scientific researches. So on those parameters also, if they stand, then Ayurveda is getting more importance, or it is going to be coming under the mainstream. And again, these have also shown to be helpful in dyslipidemia, obesity, diabetes mellitus, neurodegenerative disorders, cardiovascular, pulmonary, metabolic, and autoimmune disorders, neoplasms, as well as reducing the cholesterol, blood pressure, and inhibiting the platelet aggregation. And lipid peroxidation and antioxidant properties have already proven by different researchers. Then Amalaki is one of another important ahara dravya, which is also advocated in Nitya Sevaniya ahara dravyas as per Acharya Charaka. It reduces the pitta burning sensation and it is very good for diabetes. It is a very rich source of vitamin C as well as antioxidant, rich in antioxidant. And one more important thing is even at high temperature, this nutrient level is going to be maintained. So again, an ideal item, it can be used in different forms in the diet. And Mridvika is considered as one among the best roots as per Acharya Charaka, and it is a very good rejuvenator also. It is helpful in cough, bleeding disorders, asthma, weakness, anemia, burning sensation in the body. All these things are quite beneficial. So this again comes under one among the Agya Ahara Dravyas. And the dadima or pomegranate is very good for heart, pacifies kapha and pitta. So all these things, which are simple food items, but at the same time they can act as very efficient medicines because of their antioxidant properties. Then comes the Vihara, that is Ayurvedic lifestyle, is again absolutely necessary for bringing about the radical change in body, mind, and consciousness. This also helps in establishing a balance in one's constitution, and as all of us are aware, due to the diurnal changes, there is a problem with our there is disbalance of the doshas. So to normalize these doshas, the dinacharya are highly essential. Along with that, they also help in digestion, absorption, and assimilation, and also they are having an important role in the mental health of an individual by enhancing the self-esteem, discipline in the person, or else the bringing about peace, happiness, and longevity in an individual to the lifestyle. And again, it starts from getting up early in the morning to taking good food habits or else certain practices, like especially rejuvenating the practice like Usha Jalapana that has been advocated, Ashtaprasuti Jala intake. Again, it has been mentioned clearly wherein we can prevent diseases as well as we can have a long life that has been mentioned. Along with that, the eating habits as well as praying regularly or else using of Pratimashanasya, Abhyanga, all these things are helpful in enhancing the immunity of an individual, or in other way around, the in Ayurveda, if terminology, if we tell, then Bala, enhancement of the Bala, it is highly essential. Then coming on for certain practices which are very simple one that can be adopted and they can prevent a very wide variety of the diseases as well as the give a person healthy hair, healthy skin. So Pratimashanasya is one among the important thing wherein Pratimashanasya if done daily can prevent the graying of hair, wrinkling of skin and also the hair fall and also the many of the allergic disorders or else in the infectious disorders like even in the Ayush guidelines, Pratibha have been indicated for the prevention of the COVID infections. So, like that, this is one of the time needed is very small, and again, the amount of money spending is also very less because Kilataila is readily available, or if you want to buy, then Anutaila can also be used. That is also Anunam Srota Samhitam, that is which will be helping in nourishing the srotases at the same time opening up the srotases, so that will be helpful in even preventing the allergy problem with the pollution. Now most of the metros are facing the problem of the pollution, so that prevention of the allergic disorders due to the pollution are also possible to the Pratimarchanasya. Then stress is one among the factor that will be leading to many of the diseases. That is Vishadu Rogavardhananam that has been mentioned in the context of the 25th chapter Charaka Samhita. So stress is one among the important factors that has to be managed through the daily regimens like Abhyanga, which brings about the relaxation of the body, rejuvenates the body, and boosts the immune system at the same time. It has been mentioned the Sir Jarashrama Vataha. That is, it will be helping in preventing the Jara also, which is one among the important factors. So this can be taken as a Rasayana here, and different medicated oils can be used again according to the convenience, and again if a person is having certain problems then can be specifically indicated with the different oils. Then, as mentioned previously, mental health is very important, a state of well being in which every individual realizes his or her own potential, can cope with the normal stresses of life, can work productively and fruitfully, and is able to make a contribution to his or her community. So, in the present time, crisis, especially, many people are committing suicide. So, the mental health plays a very important role for preventing such kinds of the problems also. So this particular thing again, mental health, wherein 20% of the children suffer from the mental disorders. 8 lakh people commit suicide every year, and it is an important risk factor for developing the disorders like hypertension, cardiovascular disease, diabetes mellitus. So if we think on all these grounds, then the mental health is most important. And again, the prevention, care, and promotion are most important factors. Here, the mental health begins with me. So, what are the steps taken for us? That is Advaita, as already discussed, Achara Rasayana and yogic practices together can help in bringing about the mental equipoise. Actually, if we think about the mental health, then the situations are not going to change, but the reaction to the situation can change. So, our reaction to the different situations can be managed only when we are having the control over the mind through the control over the breath. And there are various major rasayanas that have been mentioned: Yashti Madhu, Mandukaparni, Guduchi, or Shankha Pushpi, Ashwagandha, and Pushmanda, which is one among the dietary items, and other things like the forbiddance from the alcohol, sexual act, violence, adaptation for non-violence, or politeness of the speech, practice of japa, cleanliness, respect towards the elderly, etc. They are considered among the good behaviors that can be coined under Sadvrita as per Ayurveda. They are highly essential for the mental health of an individual. Achara Rasayana, we have already gone through this Achara Rasayana very well previously also. Then the yogic practices, they include the ethical practices, yama niyamas, along with the physical practices, asanas, pranic practices, pranayama, and meditative practices. The meditation, which before that, the basic, that is pratyahara, or the concentration practices that have to be practiced regularly for reduction of the stress, anger, and emotional turmoils, and bringing about the mental relaxation. And even in the modern researches have mentioned that these stresses lead to the free radical generation, and these free radicals, they fasten the aging process, they bring about the different diseases. So the mental relaxation is very much essential. Next, coming on for the different mode of action, how exactly these things act as rasayana on modern terminology. If we think about the, like, so many researchers have already been taken care of, but still I am concentrating on a very few aspects for due to the shortage of time. As milk and ghee are considered among the best rasayana dravyas as per Ayurveda, and they are most commonly used, especially in the Indian scenario, and they are economical. And what are the nutrients that are present? That is calcium, magnesium, selenium, riboflavin, vitamin B12, pantothenic acid, and so many and so forth. Along with that, antioxidants like carotenoid, retinol, and tocopherol, etc. They are helpful in preventing the aging, also the non-communicable diseases. And in our study conducted, it was found that very high significant level results were seen with respect to the cancers and cardiovascular diseases in the persons who were taking regularly the milk and ghee in their diet. And again, the thing also is associated with mental faculties, wherein dementia and Alzheimer's disease is inversely associated with the intake of the milk. So one who takes these things regularly will be able to prevent the diseases in the elderly age. And again, ghee is again having all the fat soluble vitamins A, D, E, K. Along with that, it is rich in antioxidants. And advantage of this, like previously, they used to discourage the intake of milk, but here it has a short chain saturated fatty acids which are easy to digest, and at the same time, it increases the excretion of dietary cholesterol and bile acids from gastrointestinal tract. And conjugated linoleic acid at fatty acid that occurs in ghee has been recognized as anti-carcinogenic, and anti-carcinogenic effect has been demonstrated in several animal models also. But again, many large sample studies, especially the clinical studies, need to be taken in by we Ayurvedic people, because always we tell that ghee is very important, that has to be taken, but the scope is very wide, and the researches need to be done in different fields and on the different models. And again, the mental calmness and improvement of the memory can be brought about by major rasayanas, different benefits, especially the Shankapulpi we think about, then the patient's anxiety neurosis by modification of GABA system at the level of synthesis of GABA mediators in release or uptake of or metabolism. And pharmacological studies have also shown that hypotensive and tranquilizing effects. It induces feeling of calmness, peace, and good sleep, and relieves anxiety, stresses, mental fatigue, and producing significant reduction in the anxiety and neuroticism arising due to the various stresses. I'm concentrating more upon the stress and mental factors, because for a healthy aging, these have to be avoided. So when the ahara and vihara, if we are not able to manage with, then the aushadha or the rasayana dravyas will be quite helpful. Guduchi as antidepressant, like effect by interaction with the adrenoceptors, dopamine D2 receptors, serotonergic and GABA receptors, hence enhancing the level of norepinephrine, dopamine, and serotonin, and decreasing the level of GABA in the brain of the mice. Licorice is known to have multiple pharmacological actions, including adrenocorticoid like activity, hence helpful in reducing the anxiety and aggression of the individual. And like that, so antioxidant, hepatoprotective, and anti-inflammatory effects have also been exhibited by the guduchi. Again, guduchi is one among the dravyas, especially that is having immunomodulatory effect with decrease in the IgM and increase in the HB levels, as seen in well-being were observed again in the different researches. And also pranayamas acting on the stress and anxiety, dhyana acting on the manomaya kosha level, bringing about the equilibrium status, and shavasana, steady, smooth, and fine deep breathing, also maintain the various nerves and calms down the mind. Anuloma Viloma Pranayama is quite helpful in increasing the oxygen supply, and especially strengthening the respiratory system. The Nadi Shodhana Pranayama as well as Brahmari Pranayama, especially they will be quite helpful in enhancing the lung immunity or improving the lung capacity. So this will be acting both on preventive as curative grounds for respiratory diseases, as well as the bringing about the control of the mind, because chale vate chalam chittam nishchalo nishchalam bhavet, it has been mentioned. So it will be helpful in controlling the mind also. And Brahmari again reduces the anxieties, stress, and insomnia. Also, the having the helpful in concentration and reducing the blood pressure and heart disease. So that is about the various modes of action, how they are going to act on the modern grounds also. To conclude today's session, a holistic approach with modification of attitude, that is adoption of sadvrita, intake of rasayanas in the form of ahara, vihara, and like achara rasayana, yogic practices, and aushadha like ashwagandha, shankapushpi, mandukaparni, etc., are ideal in bringing about the health promotion and disease prevention. The implementation of these principles from early childhood itself is going to help in enhancement of the immunity and prevention of the variety of infectious as well as lifestyle disorders, and also to improve the mental health status of the individuals in the community. So we have to adapt all these aspects in the form of ahara, vihara, and aushadha as the rasayana therapy for the health of an individual. So thank you all of you for your patient listening, and I thank organizers of Bharati Vidyapit, especially Dr. Kirti Bhatia ma'am, for providing me this opportunity, and thank you again for all of you for being present.
Hello?
Yeah, hello.
Yeah, ma'am.
If you
Yeah,
have any
hello?
questions, I'll
Yeah.
be happy to answer.
I think so. You have given it in such a simple and good way. The presentation was that everybody has understood the topic very nicely. You have emphasized Rasayan in all the levels, the physical level, the mental level, the spiritual level, and in the pandemic time, the social level which is needed. The mental health had also been stressed by following the guidelines of Sadhavritta, Achar Rasayan, along with the Rasayan that is given in the spiritual